Okay. Hi, welcome to Health Tech with Purpose.
Thank you for having me.
So before we go ahead, we would like to know a little bit more about you, about your background. So we can start with a quick introduction.
Sure. So my name is Danika. I am one of the co-founders and the CEO at My Normative. Pardon me. My background is in more of the sociocultural and qualitative lens, and my co-founder comes from a epidemiological background. So between the two of us, both working in sex and gender in our academic spaces, we decided that looking at this from a data collection management perspective at scale was a worthwhile endeavor.
Yeah, awesome. So tell us a little bit more about the company and the idea.
Sure. So My Normative is a female-focused health research platform. We specialize in making sure that we have representative and accurate data that is generalizable across sex and gender and allows us to see for the differences that appear and crop up in different sexes and genders. Yeah.
So that's again interesting. And so, what was the kind of main reason behind building the company and use cases that you foresee for this idea?
Sure. So it is born from both my academic work and my co-founder's academic work. So we both worked in the female health sciences in some capacity, and both saw a pretty severe dearth in accurately and representatively selected data that accounted for the different life stages, hormonal stages, and physiological processes of the female experience. On a fundamental level in the sciences community. And so with that, we looked into what was in the market from a hardware and a software perspective for data capture, saw that there was a very big and significant opportunity there, and decided to pull the pin and try and do something about it.
Amazing. So, how does a person, kind of start using the app, and what's the entire flow? If you can help us through that. Is it like a B2C? Are you directly talking to the patients, or is it through providers that you will be collecting the data? Just help us through the process.
That's a really good question. So we actually get that a lot of people look at the app that we use for data collection and assume that we're a direct-to-consumer plane. And we do not. But what we wanted to do from the outset was create a data collection vehicle that centered the research participants' experience and provided value, which is why I think that feeling kind of comes off, which is great. We work primarily with research organizations, both public and private, to facilitate research that needs to get done. Participants use the app for the purpose of data collection and health research.
Okay, so it of course it then happens through the research people, right, who wants the data. So what's the flow? If you can explain us the flow. So for example, say somebody wants to do a research, right? And does it start from that and then they start using an app and send the link to the participants to go through the service? How does it work?
Yeah, absolutely. So when someone wants to do a research project and use the right platform, they can reach out and either interact with us because they want to customization, which is quite frequent, or they can sign up for My Normative and have it off the show.
Yeah.
With that, they create a project, they go through their own internal boards, regulatory compliance pieces, etc. They set up their project as it is, and it's ethically approved, and then they can kind of hit roll out and start recruiting.
Amazing. So today, I think demographics is women only, right?
So we're female focused.
Okay.
So most of our knowledge translation health literacy improvement, which is obviously a significant value add, is focused on the female population.
Okay.
That the technology is built to be able to adapt not only to eumenoric populations, demonstrating people, but anybody across the life stage for female persons, as well as intersex, transgender, and cisgender male. So we have the capacity for that, but where our specialization lies is in that female focus.
Got it. So so technology can scale up on any side. Amazing. So one of the things that I would like to understand, and I think everybody would like to understand, is what are the challenges you faced while actually building this? Because I think you are coming more from an academia background with deep knowledge about data and the study that you have done. So building and taking it to the technology side of things. So what were the challenges you faced?
Challenges from a technology side of things. I mean, I think the big piece, we have a lot of terrible metaphors early on. We're like, oh, just build the skateboard version and then build the scooter version, and like really, really agile small pieces. But when you're trying to fix something that's kind of fundamental to the entire infrastructure with which we commute, you can't start with the skateboard. You have to kind of start with a bigger piece of the puzzle and work into that. So that was a pretty big undertaking. And the other piece was learning to be okay with bad technology. You have to do a first version and try it and learn from it and use it. And so even though you know that this isn't what you want your technology to look like, being comfortable with launching those pieces to just get started was a big learning curve.
Yeah, because kind of first launching something is key, and then you can keep improving because there is nothing perfect. It has to continuously improve. That's amazing. So, how do you see this scaling, and what are the use cases today? And if you can take one of the use cases that probably you have facilitated this for, that would really help to understand it.
Sure. Sorry, can you ask that question again? I feel like that was a couple of different pieces of questions.
Yeah. So I think the first one, then let's go to if there are any current use cases that you would like to share where the technology has helped.
Yeah, we partner with research organizations all the time for them to do their research on their platform.
Yeah,
that is the use case.
Yeah,
you are studying stress in female populations. You're studying perceived readiness. You're studying self-efficacy. You're studying whatever it is. You do research on the platform. That is the use case. Specifically, that is the researcher within the academic institution use case. The places in which we are growing into are more on the private research, so research organizations involved with different verticals across different sectors. That's where we're kind of scaling into. But it was strategically important for us to gain the trust, reliability, and reputation for scientific rigor by partnering with these public academic institutions first.
Okay. And right now, is this based out of the US only? Do you see this scaling up to different geographies as you move ahead?
So My Normative is a Canadian company. So we are first and foremost based out of there. We do have some projects that are starting to take off in the US and Canada. So yes.
So it is kind of geography agnostic, and that could be one of the next things that you are kind of looking at to scale.
Yeah, it is geography agnostic, but not regulatorily agnostic, right? So there are pieces around that every time we go into a new location that we have to manage.
Yeah. Amazing. So, one thing I would like to take your opinion on, and that is related to the AI, right? A lot of things have been discussed about AI and, responsible AI, as you could say, on the healthcare side of things. You are having good amount of data that will be collected for research purpose. Do you think having AI built on top of this is going to help to a certain extent? And what's your take overall on the AI?
Yeah, so it was really important to us to just kind of some fundamental underpinnings here, and I gave a lecture here today on this, which was that when we capture data, those data points are representative of the cultures in which we exist. So what we decide is important enough to be collected, important enough to be cataloged, and important enough to be tagged. And the ways by which we classify information impact the utility of it, right? So it says nothing about the intrinsic value of the data itself, and more about how we perceive the data, right? And so as we start to build algorithms and machine learning on top of that data, if we don't include all of the different pieces that we need to be able to represent our populations more accurately and create generalizable kind of pieces out of that, then we're going to start having equal distributions across different populations. And the health comes from people interacting with that data and from the algorithms and the learnings that come out of using those from a diagnostic tool side.
That's interesting. And then would the AI become an intrinsic part of the whole system, or do you think the AI kind of becomes the part of the study that's happening? So, like for example, once you are doing the research for a particular institute, right, particular research organization, are you looking at collaborating with them and then providing more insights on this, or you're looking at the whole data set that you have and then see what you can give back to the intake?
Sorry, there was a bit of a big, multifaceted question. Yes. So machine learning is an intrinsic part of what we do. Whether or not you would define that as artificial intelligence is an entirely different step to that process.
Yeah.
I don't know if you know that, but I just want to be really careful. So, algorithmically, those are things that are core and central to the work we do, and the machine learning that goes along with that is very, very, very important. And when we work with a researcher, they might have very specific things that they're pulling out from their intellectual property that could or could not have any overlap with what My Normative does.
Got it.
Right. Because that might be a contributing pool or population that we were missing from other pieces as well that we might want to learn from, but we would never pull someone else's IP or anything like that.
Awesome. So, what are some of the impacts that this technology has done so far? Any particular shout out you would like to do that it's helped in a particular research? Had it been not there, it would have been a difficult thing to do. So, just want to understand the overall impact.
Yeah, so currently there's a couple of ways. The only ways to actually account for hormonal variability in the female population is to do lab work.
Yeah.
So it's prohibitively expensive, it's a big participant burden, it's a big researcher burden, and so because of that we get like an average N value of 12 in female-focused clinical trials or observational studies. So it's just too much. And so we've had really incredible successes of taking the same budget that you would use to test like 50 people and testing 1,000 people with it instead, because we're able to do it from an algorithmic perspective instead of a traditional wet lab setup.
Yeah.
Right. And so being able to then decentralize those clinical trials and include more variable populations in that data set, we're able to create more representative insights. Right. It's really exciting to provide that sort of scalability to our research colleagues.
Interesting. Yeah. So basically, the reach is kind of increasing. It's easier to reach a lot of people and get those data samples. That's one of the key impacts that I could, see. And that's one of the great things. Yeah. So moving ahead, we would like to understand the purpose behind this, right? So what was the main reason for the idea per se, and where do you see it going?
Sure. So unequal distribution of health outcomes across sex and gender. That's the driving piece.
Yeah.
And so to not have that, we need to collect, manage, and analyze information that is representative across all sexes and all genders.
Yes.
And so if it is too expensive and too burdensome, and too many people don't like getting pricked with needles all the time, or peeing on sticks constantly, or having salivary swabs done, or even bothering to learn about the menstrual cycle or how it impacts pharmacokinetic uptake, let's just make it easier, right? Yeah. Let's make it so that we don't have those excuses in the way of including female persons in our clinical and observational studies.
Amazing. Great. I think, we learned a little more about your work. I think you're doing amazing, and all the best for that. And thank you for joining us.
Awesome. Thank you so much for having me.
Thank you.